Yes, you're welcome to another lovely episode of
Health Matta.
Health Matter. With me, Slimy and Dr. Barth. We're going to carry on and enter the permanent site as far as Health Matter is concerned. Good morning, sir.
Yeah, good morning.
Good morning, ma.
Good morning,
Honadi.
Chief Olajatal. How you doing?
In the house, as always.
Good morning, Doctor.
Slimmest of
Good
them
morning,
all.
sir. How you doing,
Pleased
sir?
to have you.
Good to have you too.
Yeah. So good morning once more, viewers at home and around the world. My own name is Dr. Bartholomew Ufoegbunam. I'm the Medical Director of Grace Valley Medical Center here in Lagos. Today we are still looking at tuberculosis. Don't forget, every 24th of March, the world commemorates or celebrates the World TB Day. Now, why is that date mapped out for the commemoration of TB? It was actually the date that a major discovery about tuberculosis was made in the year 1882. Dr. Robert Koch, who discovered the bacterium that causes tuberculosis, actually announced his discovery on that day. And since then, that day has been mapped out or marked as a day in which the world as a whole, WHO alongside her partners, raised awareness concerning this deadly or preventable disease to sky high, talking about the devastating health, social, and economic consequences that is associated with this disease. And today, we'll be looking at a number of other forms of tuberculosis. Now, tuberculosis is said to affect 1/4 of the world's population. And that is to say that 1/4 of the world's population has tuberculosis. But usually, the one that predominates, there are essentially two forms of tuberculosis.
Yes.
The latent TB
And
as well as the active TB.
Tell us that one
Yeah,
last week.
last week.
The latent TB usually covers about 85 to 95% of all cases. People who are infected with latent TB carry the Mycobacterium tuberculosis in their system, but they do not come down with the disease.
Yes.
That is to say that they do not manifest any form of symptoms
Yes.
whatsoever. The people who have active form of the tuberculosis are actually the ones that have TB disease or come down with the infection, usually presenting with symptoms in 75% of the cases. Among the people who have active TB, there are still a handful, 15 to 20%, that may not present with any form of symptom whatsoever. Apart from latent TB and active TB, we also would like to talk about the causative organism. Okay? Lately, we had a video that was trending in the internet where we saw another form of tuberculosis that can actually infect man. I'm talking about bovine tuberculosis. Bovine tuberculosis.
Waiting that one.
Is it under active?
Good. Now, it's not active. Okay, it's essential it's important we talk about it so that we can actually put things in proper perspective so that people can actually know a thing or two about this disease.
Yeah.
Globally, in the year 2017, for instance, from World Health Organization released statistics, it showed that 4,500 people die daily as a result of tuberculosis. And about 30,000 people are said to be infected on daily basis as a result of tuberculosis. The percentage of people that are affected by bovine tuberculosis, an estimated 147,000 people were said to be affected by bovine tuberculosis. And out of this 147,000 people that were affected, 12,500 people did not survive. Okay? So in that same year under consideration, about 1.6 million people were said to have died of tuberculosis. So it's actually a small percentage of the population that is affected by bovine tuberculosis. What is bovine tuberculosis? Bovine tuberculosis is actually a chronic progressive disease that usually affects livestock.
Oh.
The major livestock that is affected is cattle.
Cow.
Yes. Nama. Okay.
Now, the name we understand.
The name that we know in this environment. So cattle is one that is affected most, alongside other wild animals. So the transmission could be from cattle to cattle, or cattle to goat, sheep, badgers, as well as cattle to human beings.
So if person shop meat, where you get bovine tuberculosis, now person go get the bovine tuberculosis.
Thank you very much, sir. We will see all that because we're going to show a video along the line.
Yes.
But to quickly take your question, sir.
So I need gentlemen.
Yes. If you eat meat that happened to be contaminated, if the meat was well cooked, you're not likely to come down with the disease. You're not likely to have the disease. But if you eat it raw, or when it wasn't well cooked, you're likely to get the disease. But beyond all that, if you have an injury, if you're involved in the process of selling meat in abattoirs and you happen to have an injury on your hand before the meat gets cooked, you can actually infect yourself. So it can be, humans can be infected through breaks in our skin. Okay, but beyond all that, the major infective route for humans is actually through direct contact with some of those animals. Okay? Usually, the lungs of those animals or cattle are said to be affected. So, when the major route of infection to humans is the consumption of unpasteurized milk, as well as other dairy products. Okay? What do we mean by unpasteurized milk? Milk that was not boiled. Okay? So people who are
processing.
So people who are in the habit of taking milk
directly
from cow, raw, the way it comes out from cow, you're actually exposing yourself to such a disease. Okay? Now, I will tell us a short story. In 2011, a woman, a Kenyan woman, okay, who lives in a city very close to Nairobi, the capital city
of Kenya.
She belongs to Maasai community, okay? They are known with their association with livestock. I think that should be their major source of livelihood, okay? So this woman, because of some of the practices that are done in her community, sometimes they kill a goat, they kill an animal, and they drink the blood directly because they believe it has some medicinal values. So the woman came down with a sickness that started with abdominal distension. She just noticed that her abdomen kept swelling and swelling and swelling. And of course, she went to the hospital and she was operated upon.
Okay.
And it was discovered that she had plenty of pus in her intestine, which was actually treated and she got better. But she was also told that what caused her problem was bovine tuberculosis. And ever since she survived, it was difficult for her in trying to convince her community that they should stop some of the practices, unhealthy practices they were doing with livestock that can actually subject one to this type of infection. Okay, by the end of the day, she ended up forming a non-governmental organization that was essentially involved in health-related issues, and that WHO has actually partnered with her NGO. Okay. Now, talking about how these animals can infect humans. For instance, cattle. They can infect us with secretions, nasal secretions, respiratory droplets that are coming from their mouth. They can infect us because this bovine tuberculosis, Mycobacterium bovis is the name of the bacterium that causes this in mammals, can actually come out in the milk as well as the feces and some other fluid that will come out from the body. Okay, so people who are in close proximity with animals of this nature,
or their areas,
yes, can actually expose themselves to bovine tuberculosis. However, the percentage of the population that is affected by this bovine tuberculosis are said to be insignificant when you compare to the mycobacterium tuberculosis, which affects human, okay, that account for affecting or infecting 1/4 of the world's population, okay, that accounted for loss of 1.6 million lives in 1 year alone, 2017, okay? And at the beginning of the program, we also said that about 4,500 people die daily as a result of mycobacterium tuberculosis. So the major emphasis should be on mycobacterium tuberculosis and not the bovine TB. But shortly, I would like us to see a video so that we can learn a thing or two from the bovine tuberculosis.
So
story.
now we'll not eat meat again.
You are even lucky. You know, say your own
I
head.
don't.
Ordinarily,
Because now I
egg.
don't even understand.
You don't even dey chop me.
So I'll be using egg now to eat
Department,
eba.
please, can you help us with the video?
Let's see
Thank
the
you.
When they
video.
use egg, chop
No,
eba.
seriously, it just gets it scary. I don't know.
Bovine tuberculosis, referred to as TB, is a chronic contagious bacterial disease of livestock and occasionally other species of mammals, resulting from infection with Mycobacterium bovis. Infected animals with progressive disease shed the bacteria in respiratory secretions and aerosols, feces, milk, and sometimes in urine, vaginal secretions, or semen. As a result, disease may be spread in a variety of ways, most commonly through inhalation of microdroplets in aerosols from already infected animals and from the ingestion of contaminated food and water. The bacteria associated with the disease may lie dormant in an infected animal for years without causing clinical signs or progressive disease symptoms. It can reactivate during the periods of stress or in older animals. When disease becomes progressive, it generally results in enlarged lesions, which may be found in a variety of tissues, including lymph nodes of head and thorax, lung, spleen, and liver. In countries with eradication programs such as Canada, advanced disease is rare, as most cases are detected at an early stage when infection typically consists of a few or small lesions in lung or lymph nodes associated with the respiratory system. Bovine TB is a zoonosis, that is, an infection that can be transmitted from affected animals to people, causing a condition similar to human tuberculosis. People are most commonly infected through ingestion of unpasteurized dairy products derived from infected animals, but also through inhalation of infectious aerosols or direct contact through breaks in the skin. Currently, the risk to the general population in Canada is considered to be very low due to pasteurization of milk and livestock surveillance and testing programs.
Yes, we want to welcome you back. I'm sure a lot of us must have seen the video that was displayed, that was shown to us a while ago, talking about bovine tuberculosis. Okay, at this stage, it would be nice for us to open the phone line so that viewers at home can actually make contributions and ask questions, should there be any. Slimy,
Yes,
help us
doctor.
out, as you always do.
Okay, so guys, of course, the numbers to call they on your screen, but then let's still call them now. Call them out. 081-054-3498 and of course 081-7314-758. Just kill the volume on your TV set so that we feel relate with you well. Okay.
Okay, so you can see from the presentation that he just did, it affects some certain parts of the cattle, of the meat, the liver, the lungs, and as well as the lymph nodes. Okay, so that video that we talked about that went viral, we actually saw where meat were displayed and they were showing some tubercles.
Doctor, but in that video, that particular video that I watched, that I think you saw, blessing at the intestines, and I mean they affected because I saw them with, was it liver? I don't know,
it
but
was
more.
actually the lungs. It was actually the lungs. If you
How do we know which one is the lung? Because it's not we that kill. We just go to the market to buy.
When you get to market or go to abattoir to buy meat, they usually have names for each part.
Of course.
Okay, people who are involved in who buy meat in commercial quantities, they know their names. They will ask for a particular setting. Yes. Give us liver, give us lungs. Especially people who make suya. Okay, so you can imagine if one someone that is involved in making suya buys such a meat and is dishing it out to people on the streets like that, because these are meats that we do know that are not well cooked. Okay, so that said, the degree of infection, so to say, but first I also want to thank the makers of that video. Okay, I think the Lagos State government was involved in that video. At least they've been able to sensitize the public that tuberculosis is not just humans infecting humans, that we can equally get infected by our contact with animals, especially when we consume unpasteurized milk, as well as other dairy products, as well as coming in close proximity with cows. This should go for people who rear animals. Yes. Okay, it's not only cows that are affected. I'm sure before now people didn't know.
I didn't even know it was there with animals. I didn't see that.
If you still take unpasteurized milk, taking milk directly from your cow, it is not safe to do so. By doing so, you can actually expose yourself to bovine tuberculosis. So know that today. So all thanks to the people that actually brought this, yes, and brought it into limelight. I think I also saw the Lagos State Commissioner of Health in the background talking about Dr. Jide Idris, if I'm not mistaken. So thank you for a good job that you're doing. Okay, so let's go over to the signs and symptoms of tuberculosis. How do we know who have tuberculosis and who does not have? We have said that in most cases, depending on the type of tuberculosis, if it is latent, such a person does not manifest any symptoms. But in a situation where one has an active disease, even among the people that have active disease, 15 to 20% of them may still show no symptoms. Okay.
We have a caller, John. Good morning.
From Oshu.
Good morning, John.
Good morning.
You're welcome to the show.
My question is, what is the incubation period of bovine TB in man?
Incubation period of bovine TB.
In man. Thank you very much.
The incubation period, when the man consumes the bacteria from the animal.
Okay.
What is the period of the sign and symptoms will show up in man?
Okay.
Thank you very much. So 2 questions in one. Number 1, what is the incubation period? What are the signs and symptoms when someone is coming down with bovine TB? Now, the incubation period usually will last for months, oftentimes months to years. Even within the cattle, it's a slow-growing bacteria. Okay, so it takes several years before it will actually manifest. Some of the cattle that may be infected with the disease, it may be dormant in their system. It may be inactive in their system. But when they are aging or when they are under stress, it can actually begin to become progressive in such cattle. Okay, so some of the signs and symptoms that you can find in bovine TB are the usual symptoms we have in Mycobacterium tuberculosis, the one that affects, or the human type of tuberculosis, the one that affects the lungs. Okay. Usually you have, top on the list will be unintentional weight loss. Someone is losing weight not because the person desires to do so, or not because the person is on keto diet and a number of other weight losing schemes that people get into. Okay, drenching night sweats, excessive night sweats. I don't want to use the word night sweat because all of us, oftentimes, some of us sweat.
I tell you for days now.
Depending on the climate, so some of us sweat at night. But when we say drenching night sweats, okay, it shows that it is not just the normal night sweats. Okay, the person may have cough, usually chronic cough, that may have lasted for weeks or months. Oftentimes productive of sputum, that is blood stain. Or in some situations, such a person can be coughing up blood, okay, and then the person loses weight. Now, depending on the organ of the body that is affected, the symptoms may vary, okay, on the basis of the organ of the body that is affected. Don't forget that last week we also pointed out that the tuberculosis that affects the lungs are called pulmonary tuberculosis, okay. Now, the ones that affect other parts of the body other than the lungs are called extrapulmonary tuberculosis. And notable sites that can be affected in extrapulmonary tuberculosis, number one, it can affect the spine. When it affects the spine, the person may have what we refer to as Port disease.
Yes.
Okay. Now, this Port disease can come with chronic back pains. Okay. If it's undiagnosed over time and if it's untreated, such a person can actually become paralyzed. Okay. If it affects the brain, the meninges, the covering of the brain, the person will have tuberculosis meningitis. If it affects the covering of the heart, the person will have tuberculosis pleurisy. It affects the urogenital system. The person will have urogenital tuberculosis. So depending on what aspect of the body, sometimes it can even affect the kidneys. If the kidneys are affected, the person may be passing blood in urine. So the symptoms can actually vary depending on what part of the body that is affected by the disease. But having said that, it will also be nice for me to point out that it is difficult to actually, okay, we'll have Emmanuel from Abia. Emmanuel, good morning.
Good morning, Mr. Emmanuel.
Yes. Hello?
How are you doing?
I'm fine.
Oh, yeah. Dr. Barth is here.
I want to ask question.
Go ahead.
Go on.
What about people that smoke? People that smoke, are they having that? Can that cause tuberculosis?
Thank you very much. Is that all your questions, sir?
He wants to know.
Okay. Now, yeah. Okay, so there's what we refer to as risk factors when we are talking about tuberculosis. It's so for other disease conditions. Yes. Okay, so smoking is one of the risk factors for tuberculosis. Okay, so if you're someone who smoke, you have doubled your chance of picking up tuberculosis. Especially if you have been infected, if you were probably incubating the latent TB without knowing, the one that we said that does not usually show symptoms. Okay, if you had that before and you've been in the habit of smoking, you can actually end up increasing your doubling your chances of picking up this infection later in life. Other risk factors too that it would be nice for us to point out is HIV. HIV has a special association with tuberculosis.
Special?
Yes.
Why special, sir?
Yes, I say this because oftentimes people who have HIV have, I think, about 13% chances of picking it than any other person in the population. Also, I will refer to the figure that WHO released in 2017, okay, in a year where 1.6 million people were said to have died of tuberculosis. That particular year, about, is it 30,000 or 300,000 people? I think it was 300,000 people that have HIV were involved in that 1.6 million number. Okay, so it has a special association with TB. So anybody who has HIV, you're advised today to always make sure that you go to hospital for evaluation. Let them check you if you have latent TB. If you have latent TB, the treatment can be commenced so that it can be cleared from your system. Don't forget that the initial stage we said it is preventable and it is also curable. Okay, but in a situation where you have and you do not know, not just people who may have HIV, everybody should do that. Okay, because the theme for this year's World TB Day is treat, find, treat, or #end TB. Okay, so nobody should be left out. Everybody needs to be involved. If we are talking about 1/4 of the world's population being affected, we can actually not say who among us here may have been exposed. Okay, so other risk factors are people who have had organ transplantation. Okay, they are on the high risk or higher risk of picking up this disease. Anybody who has a weakened immune system, okay, which can be as a result of HIV, diabetes, or prolonged therapy on corticosteroids, is a form of drugs that usually people who have undergone transplantation of organ transplantation will usually be on for the rest of their lives to actually avoid organ rejection. Okay, so severe kidney disease are one of the risk factors too that can actually happen in this infection. Okay, so it would be nice for us to also add, apart from the ones that we have mentioned, substance abuse.
Like drugs?
People who abuse IV drugs are also at risk of having this infection. Okay, now this infection thrives more where you have overcrowding and malnutrition. So it's said to be one of the principal diseases of poverty. Okay, so in settings where you have overcrowding, you can have that in nursing homes, you can have that in prisons, you can have that in refugee camps or school hostels or dormitory, religious centers. Okay, people who are in such environments are actually at risk, depending whether or not they have somebody who has been infected. As a matter of fact, last time that we were talking, last week when we talked about the transmission, somebody with active TB that coughs, that sneezes, releases thousands of droplets.
Each of them.
Of course.
Yes. That can actually infect the people around such a person. So it is airborne. Okay. Apart from that, the fact that it is airborne, if you have breaks in your skin, wounds, injuries, usually people who work in abattoir in trying to slice knife and cut meat and do this, sometimes they end up cutting themselves, giving themselves injury. If you have such an injury and you're probably handling beef that contains this Microbacterium bovis, okay, you can actually be infected with bovine tuberculosis. Okay. Also, people who live in some parts of the world where TB is said to be predominant, people who live in Africa, Eastern Europe, Asia, Russia, Latin America, Caribbean islands can actually be affected. Also, where you work will actually determine how exposed you can be to such an infection.
Like which kind of work? Okay, maybe like that, but we don't talk now.
Yes. Of course, if you work in an abattoir and if you end up inflicting an injury on yourself, you know what that means. And then healthcare workers, okay, that usually attend to people with tuberculosis. Yes, healthcare givers, workers in the healthcare settings, okay, that are equally exposed. Okay, so we need to protect ourselves. Beyond that, if you have an infected person living in the same house with you, all the members of that household are equally exposed to picking up the infection. Okay, so if you have someone around you who has been coughing for some time, for a long period of time, say more than 2 weeks, please encourage such a person to go for further evaluation. The person may have TB and you may not know it. And before you know, the entire household may have been infected. Don't forget we said
Onyenuchi.
Onyenuche from Kaduna. Onyenuche, good morning.
Good morning, sir.
Yeah, thank
you.
Yes, I'm calling from Kaduna. I want to ask, having exposure like having this situation, we are talking about the people who are susceptible to contract this TB. What's my chances in that situation whereby I'm working in a clinic or manager?
Sorry, I didn't get you, sir. Can you take the question again?
Okay.
Make yourself audible this time.
Okay. I hear me.
Okay.
Diabetes, and I work in clinical setting of this nature where TB patients also come. So what's the advice to me in that situation? Should I quit the job or should what measure do you think I can apply to this?
Thank you very much, sir. Yes, I got you now. He said he's diabetic and he works in settings where people with this condition are attended to. Okay, usually, I can tell you that centers that have facilities for caring for people with tuberculosis, not all hospitals, the ward are usually located very far from all other wards.
Okay.
In a no man's land, if you want to use that word. Okay? And ventilation in such places is usually at the topmost end. And you have fans there. For people undergoing tuberculosis, you don't just allow them to just walk without having themselves covered. Okay? Usually, they are provided with face mask that will prevent them from talking. When they are talking, it prevents them from releasing, or when they are sneezing or coughing, it prevents them from releasing the aerosol droplets that can infect the doctors and the nurses around them. And also, for the nurses and the doctors and some other health workers who actually take care of them, they also cover themselves. They protect themselves because they understand the implication of becoming infected. Okay, so usually they will stay at a distance when they are attending to them. Okay, but sometimes you need to do a procedure, in which case you have to actually come at a close proximity with them. Okay, but usually too, I also want to point out that after undergoing treatment for a period of time, the degree, after undergoing treatment, for instance, for about 3 to 4 weeks, for people who were initiated on treatment for the first time, after about 3 to 4 weeks, they are no longer contagious.
Okay.
Okay? They are no longer contagious. Don't forget, oftentimes, most of the time, the treatment will have to span. If someone has an active TB, will have to span for about 6 to 9 months. But if you're being treated for latent TB, the treatment can stop after 3 months. Okay? So if you're working in that setting, you should use personal protective equipment. Make sure that your nose are covered at all times. If you have an injury on your body, you need to probably cover it with a plaster or wear gloves over it. Okay? And make sure that the room is well ventilated so that even if the person sneezes, it doesn't come directly to you. Okay, so these are some of the measures that you can put in place to actually protect yourself from picking it, because being diabetic actually weakens one's immunity. Okay, so that will kind of elevate the chances of such a person picking up this infection. Thank you very much, sir.
Thank you.
So now we want to quickly talk about diagnosis and treatment. How is this disease diagnosed? Oftentimes, it will involve taking a good history from such a patient who may present with some of the symptoms that we have mentioned. After taking the history and you suspect that this person may be having tuberculosis, permit me to say that sometimes the signs are so obvious that once preliminary investigations are done, such a person can actually be initiated on treatment, because some of the tests that will actually yes, we actually pick out the diagnosis can last for as much as 6 weeks, more than 1 month. You're still waiting. In situations where you have to do culture, sometimes some of them may take as much as
6 weeks.
Yes, more than 6 weeks, or about 6 weeks before you can get the result.
That's a month plus.
Yes, so if you leave such a person, it can keep infecting people. But however, there are a number of investigations that one can quickly do if you get to such a center. Okay? Some of the investigations that can be done will range from the blood investigation to imaging investigation. In blood investigation, you want to do a full blood count for this patient. You want to do ESR for this patient. Okay? Imaging investigation, you want to send this person for a chest X-ray or for chest CT. Okay? And also, the commonest that we usually do in this environment, thank you very much, sir, is what we refer to as Mantoux test. Okay? Tuberculin skin test, the one that usually is injected on the anterior part of our elbow. Okay? Usually injected here. You get to the hospital, the lab scientist gives a small injection. We have Sam from George.
Sam, good morning, sir.
Good morning.
Good morning.
Yeah, good morning.
Yes, Sam, go ahead with your question, please.
It's Pam Timothy, Pam P-A-M.
Thank you very much. Sam Timothy, please go on with your question, sir.
Yeah, my question is that what is the causes of tuberculosis, and is the tuberculosis transmission disease, or how it is transmitted?
Causes, is it a transmission? Is it a what? What's the second question?
I say tuberculosis is a transmission disease.
What is
Transmission, okay.
Okay.
What
something
transmission?
Yeah.
communicable?
Okay. Any other thing?
No, that is all.
All right.
Thank
Thank
you very
you.
much.
Okay,
Sam
thank you.
Timothy.
Okay, so thank you very much, Sam Timothy from Jos. Now, what causes tuberculosis? We have talked about some of the causes of tuberculosis, and we mentioned the major cause as Mycobacterium tuberculosis, MTB. And we also said that there's also bovine TB,
Yeah.
which is
Oh,
caused
yeah,
by
discussed
Mycobacterium bovis. There's also one that I didn't mention that can actually affect poultry, fowls, and birds. That one is referred to as Mycobacterium avium. Okay? Now, people who are infected, depending on which they are infected with, 95% of all infections are the ones that have to do with pulmonary tuberculosis, the one that has to do with M tuberculosis, Mycobacterium tuberculosis, which of course was discovered in 1882 by Robert Koch. So it's also called Koch's disease. Okay? Anybody that is infected with this can actually infect the person next to him or her when the person is exposed. So once you have someone around you who is coughing, you may not know if the person is infected or not. So you should encourage such a person to visit hospital so that the person can be evaluated.
Yep.
Okay? What other question did they answer?
He was asking how
if it's communicable.
Cable.
Yes, it's highly contagious. If you sneeze, if someone who has an active TB sneezes into the air, the people around the person are at risk of picking up the infection. Okay, but
It's very communicative.
usually for people who you live with in the same household or work with in the same office, you're more likely to get it from such people than strangers that probably comes across one on the street. Okay, so back to diagnosis. I was talking about Mantoux test. So usually when such tuberculin skin test is given, is injected there, within the space of 48 to 72 hours, the person should come back to the hospital so that the test can be read. Okay? In a situation where you have a reddish swelling or raised around such a place, it needs to be measured to actually get the diameter and all that. That can actually confirm that one is positive for tuberculosis. We have Dr. Sonny.
Sonny.
Good morning, Dr. Sonny.
Yes.
Dr. Sonny.
Hello.
Hello, good morning, sir.
Good morning.
Yeah. Pleased to have you.
My question is, this tuberculosis, is it all that is evident with cough?
He said, is it all that is evidence with cough? Is all of them cough?
No. It is not all that is evident with cough, sir.
And because there is one, they were telling me, they say it's bonnet tuberculosis.
Yes, we refer to that as pod disease. It affects the spine. Okay. Apart from the cough, we did say that the ones that affects the lungs are actually the predominant one affects 90 to 95% of people. That is one that has to do with cough. And we refer to that as pulmonary tuberculosis. Okay. Now, the ones that affect some other organs of the body other than the lungs are called extrapulmonary tuberculosis. It can affect the kidneys, it can affect the spine, it can affect the bones, it can affect the heart, it can affect the brain. And depending on which part of the body that is affected, the symptoms may vary.
Yeah.
Thank you very much, sir.
Dr. Sonny.
Yeah. So, I need also to talk about Mantoux test for a number of reasons. We are getting to prevention now. Now, talking about Mantoux test, the test usually is a non-specific test. When you do it and it shows positive, you still will need to do a number of other investigations to actually confirm your diagnosis. Because in some situations, it can give you false positives. And in some situations, it can give you false negatives. So it is not enough to use that to diagnose and say someone has tuberculosis. So the person can be sent to have a chest x-ray done. When the person does a chest x-ray, you can actually see some form of hole-like
pictures or
no, not pictures. coloration. We call that
Coloration.
cavitations on the film of the X-ray. Okay. Now, if you see cavitations on the film of the X-ray, is an indication that such a person will have tuberculosis. There's also another form that I need to also say, usually very, is called disseminated tuberculosis. Okay. It's usually very severe in people who have it, or miliary tuberculosis. So it's nice to mention that as well. So,
sorry, sir, before you go further, I noticed something and I want to make we quickly talk about that. When we say tuberculosis, there's this picture it paints to the society as if to say now only men, and then they get that.
How come my radio, mate?
God bless you. And if you check where one woman like this never caused, since when we don't discuss tuberculosis as it has been men. Is tuberculosis a man's disease?
Are there women, only the men?
Are there women also suffering? And what is the statistical comparison?
Okay, I may not be able to give you, thank you for the question, sir. I may not be able to give you the exact percentage, okay, but all over the world, tuberculosis affects everybody. Okay. It's a disease that has global reach, if I'm to use that word, okay, but that said, it doesn't affect all people to the same magnitude, okay. It affects more in areas where you have overcrowding, malnutrition, and of course, these are major indices that you can have when you're talking about poverty. Okay, so it's a principal disease of poverty. I must also point out that. Okay, we're getting signals that our time is up. Okay, so
are we picking up from the next week or?
Let's see how it goes. It's difficult to say because sometimes our viewers will need to call in and then tell us this and that. Okay, but viewers at home want to say a big thank you for hooking up with us today. I'm from Slimmy T. What do you say today?
I'll see you guys 1 to 2.
Okay, thank you very much. Keep watching WAP TV. Slimmy is coming back today.
So,
Top 5.
Bye for now.
Bye, guys.